Facebook live session. I am Dr. Pallavi, consultant at Oasis Fertility Center, Pune. Today I am here to discuss with you the most important topic and the most frequently asked question by the couples or by the family members of the family members who come to the clinic first. That is, are the IVF babies normal, or the babies healthier, or because these babies are made artificially, are these IVF babies more fragile to the environment, or they more fragile for the infections? These are the most common questions what we encounter in our day-to-day life. So let us clear these questions with some evidence today. So for this to understand, first you should know what is IVF. So what we do in IVF? Usually in all over the world, there are almost 20% of the couples that cannot conceive because of the natural drive. So out of these 20% of the couples, we usually advise 30 to 50% of them the IVF because of many reasons. That could be a tubal factor or a uterine factor or the male factor. There are many reasons. And for those couples who we have advised IVF, we usually give injections for them. So these injections are nothing but the hormones which are produced by our brain. But these hormones are produced artificially outside the body, and these are being injected into the body. And these injections usually wash out in couple of days. Okay, so this is nothing like which is not above, which is not away from the natural thing. So then we pick the eggs and the sperms, or we collect the sperms from the male partner, and we make this egg and the sperm to meet and undergo fertilization in outside the body. Usually, this fertilization is supposed to occur in the fallopian tube of a female. But due to certain reasons, the couples are not able to conceive. So we are helping or aiding the process of fertilization in the lab, that is in the embryology lab, under the visualization of an expertized group or team of embryologists and the IVF specialists. And people are concerned about the culture media. Usually they do ask about culture media. The culture media which we use in IVF is already embryo safe. It is proven and it is tested and it is embryo safe. That kind of culture media is only available in the market, and it has government approved things. And after the fertilization and after growing the baby for 3 to 5 days outside the body, we do introduce these embryos back into the uterus of the female. And from the day of embryo transfer till the term, the baby is inside the uterus and the baby gets the nutrition, blood supply, everything from the mother, just like the normal baby. So, the things you need to remember is, first thing, the genetic makeup. Whatever the genetic makeup that the baby is born with is either from the father and from the mother. So we are not creating anything artificially in IVF, and as usually the name artificial baby is a misnomer. Here we use artificial technology to help in the fertilization process. Okay, and the genetic material, the genetic makeup, DNA, whatever that is inside the baby is directly from the couples. And whatever the blood supply that is that the baby is getting, whatever the nourishment that the baby is getting is from the blood supply of the woman that is inside the uterus. So this is absolutely normal. So there is no difference between the normal babies and the IVF babies. Coming to the history part, let us see with the history. The first IVF baby born is Mrs. Louis Brown. She was born in 1978 with the IVF. She's the first. She was the first IVF born baby. And this so the Louis Brown throughout now she's almost like 40 to 45 years of age, and she has conceived normally. There are few couples coming to us asking that the babies which are conceived by IVF, can the babies in future will they have normal fertility, or do they again require IVF? So this is not the case. These babies can conceive normally. And the next thing is coming to the statistics and data. In the world, till now, since like 30 to 40 years, there are almost 8 to 9 million children that were born by IVF. And there are a number of studies and statistics that has been done to see how the babies were growing, and or the babies are normal, or there anything abnormal between these babies and the natural babies. So all the data and the statistics shown that these babies are as normal and as good as the normal babies that are conceived by spontaneous conception. So let us see in this perspective, like few studies they have mentioned like there is a 1% chance of increased abnormalities like minor or major anomalies in the babies conceived by IVF. But the reason what they have mentioned in those studies is the age factor. So usually when a couple conceive with a normal pregnancy, the age limit of the couple will be usually low, like 25 to 30 years, and in between that. But when a couple comes for IVF, so this couple might have tried all sorts of infertility treatment, and they finally come to the infertility clinic for the IVF. So usually these couples are in the higher limit of their age compared to the normal couples who are conceiving normally. So why this age factor is so important? Because, for example, let me quote you a syndrome called Down syndrome. Down syndrome is an aneuploidy syndrome which is more common in the elderly age group. Suppose if a woman conceives before the age of 30 or before the age of 35, the risk of having Down syndrome is 10 times lower than the woman who got conceived at 40 years of age. So see, this is for the natural pregnancy as well. This is for the IVF pregnancy as well. So this is not only about the Down syndrome. This is about regarding many number of genetic abnormalities which are more prone in the elderly age group when the couple, either the wife and the husband, if both of them are in the higher age limit or either of them in the higher age limit, then the chance of having abnormal baby is more in case of IVF as well as in the normal conception. So this 1% raise of these minor or major anomalies in these babies conceived by IVF is because of the age factor. And coming to the genetic problems, IVF is particularly, I should say, it as a boon for the couples who were already diagnosed with the genetic problems. See, if a couple already knows that they are having or carrying certain type of genetic problem inside them, so then they can have certain diagnostic tests called PGT or PGD, pre-implantational genetic testing, wherein we can take a part of the embryo. It is not an embryo proper. This is the covering layer of the embryo, wherein we can take a part of this covering layer and we can make it tested and see whether the embryos are normal or abnormal genetically. So, if a couple is already known to have a genetic problem, then we can advise them these PGT tests so that the couple will know that they are having a proper euploid or a proper genetically good embryo, so that the chances of conception will be more in these couples. So there are certain couples who ask that these embryos, if they are tested or PGCT is selected, are these babies more smarter than the normally conceived babies, or these babies good looking than the normal conceived babies? This is also a misconception. So these babies are also same because we do check for the genetic abnormalities if they are present or not. So otherwise, the genetic makeup is from the husband and wife, that is the parents, and the blood supply and every nutrient is from the mother. So these babies are also same as the normally conceived babies. So at the end, I conclude this that the IVF babies are as good as healthy as normally conceived babies, and also the IVF babies are not superior or neither inferior to the babies conceived normally. Okay, and then if at all at the end of the session, if at all I give you two babies and we give you certain time limit like a week or a 10 days or lifetime to stay with those babies, and if I ask you to diagnose which is an IVF baby, which is a normally conceived baby, then no one is going to judge or no one is going to differentiate between these two babies, because both babies are similar to the IVF babies are similar to that of normal babies. So if at all you have any doubts, you can walk into the center or walk into the infertility setups and you can ask the questions or queries regarding these topics. And you should come with an open heart, with a clear mind, and you should counsel your parents or the grandparents who are still in the opinion that these babies are made artificially. You should make them clear that the babies are not made artificially. The genetic material is from both of us. The egg and the sperm is taken from the parents, and just the part of fertilization is made outside. Apart from that, nothing is added to the embryo. We just support the process that is being taken place in the fallopian tube. We do it in the outside environment. Otherwise, the babies are as normal as the normal babies. I hope this session is useful for you. If at all you people have any queries, you can ask me. So, if you have any questions, please do come to our center and have a one-to-one interaction with the fertility specialist and clear your doubts, and you can proceed to the IVF process. Thank you.